Hi, my name's Elena, and today I'm going to talk about prescription drug abuse. Taking prescription drugs in a way that it hasn't been recommended or prescribed by a doctor can be more dangerous than you think. In fact, it's considered drug abuse and it's just as illegal as taking street drugs. Some people abuse prescription drugs because they want to experiment, because maybe they think it'll help them fit in, lose weight, or even study more effectively. Some college kids are known to take Ritalin to help them cram for an exam. Ritalin is considered a stimulant and it is prescribed to people that have ADD or ADHD, also known as attention deficit hyperactivity disorder. People with ADD or ADHD have a hard time focusing, so they're most commonly prescribed Ritalin because it helps them stay focused. So college kids will take it because it's a stimulant, it'll help them stay up all night and helps them focus. But if it's not prescribed to them in particular, it's very unsafe. A 2009 survey from the Centers for Disease Control and Prevention shows that prescription drug abuse is on the rise, with 20% of teens saying that they have taken a prescription drug without a doctor's permission. Some people think that drugs are safer and less addictive, but that's not true. Prescription drugs are only safe for the individuals who actually have a prescription for them. That's because a doctor has examined these people and prescribed the right dose of medication for a specific medical condition. The doctor has told them exactly how to take the prescribed medication and has ruled out other side effects. So when you go to the doctor and the doctor asks you any other medications that you may be on, it's very important to be honest with your doctor or physician because they need to know what other medications you're taking because certain medications can have bad reactions with each other. They also tell you to avoid alcohol with many medications and maybe even not to smoke because they make you aware of potentially dangerous side effects and doctors monitor their patients closely. When you're abusing prescription drugs and they're not prescribed to you, there's nobody to monitor these things. Most common prescription drugs that are abused are opioids, CNS depressants, which are also known as central nervous system depressants, and stimulants. Some examples of opioids are oxycodone, which on the street is known as Oxycontin, hydrocodone, which is also known as Vicodin, or Demerol. Medical uses for opioids are to treat pain or relieve cough. Opioids attach to opioid receptors in the central nervous system, which is the brain and spinal cord, preventing the brain from receiving pain messages. When somebody takes these drugs that doesn't have a pain issue, the drug acts in a way as to get them high and make them feel heavily sedated. Central nervous system depressants can compose of Valium, Xanax, which are used to treat anxiety, tension, panic attacks, and even sleep disorders. CNS depressants slow down brain activity by increasing the activity of a neurotransmitter. The result is a drowsy or calming effect. Stimulants such as Ritalin or Adderall are used to treat narcolepsy and ADHD. Stimulants increase brain activity, resulting in greater alertness, attention, and energy. There's also over the counter drugs that some people can abuse. In some parts of the country, you can only get over the counter medications from a pharmacist. If you've noticed, sometimes you'll go to your local drugstore, maybe CVS or Walgreens, because you have a bad cold and you want to pick up some over the counter medication such as Sudafed. Well, if you've noticed in the past few years, now they're not in the aisles with a lot of other over the counter medications. You have to get them from the pharmacist, and you can't get as an unlimited supply of boxes. They do this because there's a drug, pseudoephedrine in Sudafed, that is used in drug labs to make methamphetamine. Some people mistakenly think that prescription drugs are more powerful because you need a prescription for them, but it's possible to abuse or become addicted to over the counter drugs as well. For example, DXM is found in over the counter cough medications. When someone takes a number of teaspoons or tablets that are recommended, everything is fine and it'll help with your cough. But in high doses, it can cause problems with the senses, especially your vision and hearing, and it can also cause hallucinations, stomach pain, numbness, and can also lead to confusion. Dangers of abusing medications, whether they're street drugs or over the counter medications, is it can result to kids having trouble at school, at home, with friends, people, adults, children, teenagers. This happens to everybody. And you'll also find that people that abuse drugs, even prescription drugs or over the counter drugs, will also find themselves getting in trouble with the law. Because if a over the counter drug or a prescription drug is not prescribed or is being abused, it is considered illegal. Like all drug abuse, prescription drugs that are abused can have serious risks for a person's health. Opioid abuse can lead to vomiting, mood changes, decrease in ability to think, which is also known as cognitive function, and even decreased respiratory failure, coma, and even death. This risk is higher when prescription drugs like opioids are taken with other substances such as alcohol, antihistamines, or other CNS depressants. CNS depressants have risks too. Abruptly stopping or reducing them too quickly can lead to seizures. Taking CNS depressants with other medications, such as prescription painkillers, some over the counter medications, and allergy medications, or alcohol, can slow a person's heartbeat and breathing and even kill them. Abusing stimulants like some ADHD drugs can cause heart failure or seizures as well. These risks are increased when stimulants are mixed with other medications, such as over the counter medications like cold medicines. Taking too much of a stimulant can lead to a person to develop dangerously high body temperature or an irregular heartbeat. When you mix a stimulant and a depressant, it's known as a speedball effect. So you have one drug that's racing your heart and one drug that's slowing your heart down. So that's why people end up overdosing and dying. So it's very serious. Even if you could have a prescription drug that's a stimulant and a prescription drug that's a depressant. Just because it's prescribed doesn't mean that it can be safe for you. You hear in the news all the time about celebrities and even just normal people that overdose off of prescription drugs. Prescription drug abuse is definitely on the rise, and it's becoming more dangerous than street drugs. Taking several high doses of a stimulant over a short period of time can make a drug abuser very aggressive or paranoid. Although stimulant abuse might not lead to physical dependence and withdrawal, like for, let's say, an opioid can lead to physical withdrawal symptoms if you stop taking it. The feelings that stimulants can give people, even though they're not going through physical withdrawal, it can cause them to use more and more drugs often because their habit is so hard to break. The dangers of prescription drug abuse can be made even worse if people take drugs in a way they weren't intended to be used. Ritalin may seem harmless because it's prescribed even for little kids with ADHD. But when a person takes it either unnecessarily or in a way it wasn't intended to be used, such as snorting or injecting, Ritalin toxicity can be serious. And because there are many variations of the same medication, the dose of medication and how long it stays in the body can vary. The person who doesn't have a prescription might not really know which one he or she has. Probably the most common result of prescription drug abuse is addiction. People who abuse medications can become addicted just as easily if they were taking street drugs, such as heroin or cocaine or methamphetamines. The reason many drugs have to be prescribed by a doctor is because some of them are quite addictive. That's one of the reasons why most doctors won't fill your prescription without having you come in and see them every month when your prescription's up. Doctors do this because they want to make sure that you're not getting addicted to the drug. And they can tell because some people that may experience um, issues with pain and are on narcotics like opiates, if they come in and they're constantly telling the doctor, I need more, I'm in a lot of pain, it's not helping, those are signs that they're becoming highly addictive, and the doctor will have to take precautions and either wean them off or there are ways to help them and use other drugs that aren't so addicting. If a doctor does prescribe you a pain medication, stimulant, or a CNS depressant, it's very important to protect yourself. You should keep all your doctor's appointments. Your doctor wants you to come in and visit so they can monitor you and make sure your medication is working well in the way it should be, and so they can adjust any dosing that needs to be. It's very important to tell your doctor how you're feeling on your dose and to be honest with them. Also, make a note of any effects that the drug has on your body and your emotions, especially in the first few days. It'll take the first few days that you're on a medication before your body gets used to that drug. So tell your doctor about any side effects. Also, keep any information your pharmacist gives you about any drugs or activities you should steer clear of while taking your prescription. Sometimes you'll notice on your bottle that it says not to operate heavy machinery, such as driving a car, for the first few days because it takes a few days for your body to metabolize a medication and for your body to see how it's going to react to that medication. It's also very, very important not to increase or decrease the dose of your medication without checking with your doctor's office first, no matter how you're feeling. Finally, never use someone else's prescription and don't allow a friend to use yours. Not only are you putting your friend at risk, but you could suffer too. Also, people that have small children or even teenagers living at their house or visiting their house, it's very important to take serious precautions and to keep your medications locked at all times and in a safe place. Pharmacists won't refill a prescription if a medication has been used up before it should be. And if you're found giving medication to someone else, it's considered a crime and you could find yourself in court. So as long as you take these precautionary steps and keep your medication locked up from your kids and stay proactive about these things, then you can lead a safe and healthy lifestyle for you and your family and anybody that you may know that may suffer from drug addiction. Thank you.